Cobalt's a medical charity. It was established 50 years ago, actually, this year, to support mainly oncology services in this part of the world, or the three counties of Herefordshire, Worcestershire and Gloucestershire. As a charity, we like to introduce new technology, new solutions to healthcare. So we have the first high-field open MRI scanner in the UK, the first to put a 1.5 Tesla MRI on the road, the first to put a 3 Tesla mobile MRI system in Europe. So in terms of VUE Motion, the referrers who don't have access to PACS, it works really well. It's a thin client solution, it's secure, they can access it from anywhere, they can access their patients, they have PACS functionality, and they really love it. And there's no disc flying around the post. It's cheaper for us, it's safer for us, and images can be seen anywhere in the country. So that's been a real success story for us.
The advantages of having VUE Motion is that we can access the images in all these localities, so we can actually see the scans without necessarily having to come here. And importantly, we can actually show the scans to the patient, and that sort of helps with patient education. It helps solidify the diagnosis for them, because they actually see that there are some problems with the brain. So patient education is a very important part of what we do, and I think VUE Motion helps us tremendously with that. And because the quality of the images are far better, it's easier to explain to the patient what the changes are.
All the radiologists that report here have access to VUE Motion, so when they leave Cobalt, they can log in and they can view images. So it works for us, for the radiologists that work here, but also work in the different trusts. They can look at images during MDT meetings, which for the patient's pathway, it's incredible. And we also have rolled it out to several smaller trusts that don't have their own PACS system. And originally they were getting CDs, and they were getting 5 to 10, maybe 20 CDs a week. They were then receiving these CDs of patients' images, popping them on their PCs, waiting for the images to appear, and then discussing that patient, taking that out, and repeating that process 20 times is it's not a very efficient way of time.
It's had a huge impact, particularly with us being a primary care-based service. So that means that we see people across the county, and in quite a wide variety and type of location. So we're not always hospital-based, and in quite rural locations as well. So in terms of being able to access images, the MyVue system has enabled us to access images wherever we are. And also from a hardware point of view, a lot of the rural locations or non-medical buildings that we use, sometimes the computers there don't have disk drives to put the disk in and view the images. So MyVue has solved all of those problems for us.
Carestream worked really closely with us, and we came up with a solution that suited VUE Motion but also MyVue. So we've actually got a server that sits outside our server and pulls individual patients. So it's a very secure way, and it's put a lot of minds at rest here as well. Because before, thin clients, you logged in, you had to download the software, and then of course that saves onto your computer, so that was a huge risk. So knowing that doesn't happen, it sits a lot more comfortably with us.
So in terms of the patient-therapist relationship, it really helps that, because it, in a certain way, it engenders more trust from the patient in us as medical practitioners, because they can see everything for themselves, so they know there's nothing being hidden from them. They're not being told one thing, but things are being kept from them. And that helps get them on board with treatment plans, pathways. It helps their compliance with treatment.
The reaction I get from patients is, really? Wow, and you think that's amazing. So they feel empowered, that they walk away from here, they've got a little card with a password on it. They then get an email from us with a link. They then put their password in, and they have control. They have control of those images. They can send those images to their referrers, to several referrers. So it's opening that door, that pathway. Then it's more efficient. They're not waiting for us to send the images to their doctors. They're in control.
So VUE Motion and MyVue has brought huge benefits to Cobalt. In terms of data security, in terms of referrer access to images, referrer satisfaction, patient access to images, patient satisfaction, time saving from staff, cost savings. It really has been a very positive experience for all of us. It really was a joint project. It wasn't just buying a product and installing it.